Hello everyone, I did my internship at Merit Health Wesley Wellness Center. I basically had to deal with pulmonary patients and heart patients. Most of them had problems like COPD, chronic obstructive pulmonary disease, dyspnea, asthma, coronary artery disease, heart attack, and stroke. Some of them had stent put up in their artery or heart, or they had done bypass surgery recently. Most of them were elderly patients. And to talk about the age, it was over 70 years of age for most of the people. We had very few who were 40 or 45 years of age. And my main responsibility was to monitor the patients while they're working out in the cardiac rehab. I had a nurse in the room and one other coworker who used to work with me. So it was three of us who had to monitor the patients at all time, make sure they're doing okay while they're exercising. My other responsibilities include some filing work. I had to keep up with the charts, keep the information updated on the patients after the assessment and everything. And I also had to do some faxing, scanning, copying, and all that stuff. Also, there were like little bitty duties of keeping the cardiac rehab organized, like make sure we're not out of anything, batteries or like the sensitive pads that we use on the monitors. Okay, so on the patients, we would use a heart rate monitor on the heart patients, but we wouldn't use it on the pulmonary patients unless they have like chest pain or something like that. So in that case, just to make sure they're doing okay while they're exercising, we'll put up a heart rate monitor even on the pulmonary patients. My main job was to check the vitals at rest, during exercise, and during recovery. We had to make sure that the vitals were at the level that is supposed to be. Like for the oxygen SpO2, we had to make sure that it was over 90 at all times. If it's below 90, we would make them stop, rest for a while, and get them going again. Same for the blood pressure. If it's over 180 and if the diastolic blood pressure is high too, just make them stop. And you also have to make sure that they don't have any chest pain symptoms, dizziness. Most of the patients, they used to work out pretty much on their own, and they were able to adjust the levels on the machines that we had, but very few of them need like special care. Like I had one of the patients who need like sensitive pads on the heart rate monitor, and she used to like get dizzy at times, so you just had to make sure she was doing okay and she wasn't going too hard on the machines. Yeah. And to talk about the special project I completed, I didn't do anything like specific, but I got a chance to look the assessment by sitting down with my supervisor, Miss Stephanie. Yeah, so in the exercise testing and prescription class, we learned about taking blood pressure and the 6-minute walk test, but we didn't really use it anywhere. And here, working at the cardiac rehab, I was able to use some 6-minute walk test on the assessment. When we had a new patient, we would check the vitals just like at rest, just like we do every day on the patients at rest, during exercise, during recovery, and we had to make them walk a certain distance. I think it was 30 feet, but make sure they're doing okay. They're not forcing too hard, or they're like, just make sure they're doing okay. So we had to record the number of laps, and based on that we used to calculate the MET. We had a chart, so we would just look up in there. That's one of the things I learned. And I also got to like add specific exercises on patients depending on their progress. Like on some of the patients, we added balance stuff. Most of them would do new step, hydraulics, the cycle ergometer, and the arm ergometer. And like on some of the patients, we would add balance stuff like step ups, sit to stand, and weighted walks, wall push-ups, and all that. My overall impression of cardiac rehab here was really nice. I really enjoyed working here. It wasn't like boring or anything like that. So I feel like if you are interested in exercise or dealing with patients, like, or if you're interested in physical therapy, being an exercise physiologist, I would really recommend this place because I really enjoyed working in the cardiac rehab. Okay, thank you.